Okay, we're going. Cool. Adjusting this thingy. And it's okay, because, like, this is going to get cropped anyway.
Okay.
So this is not, like, going to be the finished product or anything.
Okay.
So, how did you come into becoming the ROTC student field medic?
So I graduated from a four-year biomedical academy in high school, and then I took some prereqs with medicine in college, and my first years of college. And then I continued on with these certifications, and then I noticed that there was a need for it out in the ROTC field. I mean, people get hurt, people are stroking out because of the heat and everything, and I knew how to take care of it, and it seemed that nobody else did. And whenever someone had questions, I was always able to answer them. So they just kind of promoted me to this position actually last year. So I've been able to keep up with that, and I buy and I have all the medical equipment, like even pre-surgical kits I still have for everybody that's out there.
Okay. In high school, how did you come into becoming into that academy?
So it's a STEM academy, and your first year you get to test all the different fields, and then whichever one you excelled at or that you liked the most, you would go and continue on with that field, and mine was biomedical.
Okay. Do you feel that having been prepared with those 3 years coming into ROTC and just in everyday general life that you've been prepared and equipped to handle everyday accidents that could occur?
I had trauma care, I had paramedic care that I was trained in, and as well as pre-surgical and clinical care. So I was trained in all the different factions of the medical corps.
Okay. Do you feel that many things could be avoided if people actually had a general idea of first aid?
I do, which is why whenever we have the first aid labs in ROTC, I tend to always teach them, because I know if I can give you what I need to be done, it'll be done faster. And there's almost 400. There's almost 400 of you, so one person as the medic is not enough. So whenever I doctor up somebody, I tend to tell them how to prevent it. Then they can help their battle buddy or whatever.
How do you think our generation could become more knowledgeable in the matter? Or do you believe that they may need a harsh wake-up call before they even understand how important the basic knowledge is?
Unfortunately, with ROTC, with the military in general, a harsh wake-up call tends to always be the case. We don't teach these things unless it has to be taught because it's happened. You know, for example, teaching a sucking chest wound is because people have been shot so much and the survival rate has been so low. So now it's mandatory in order to even graduate to know how to treat a gunshot wound. And I mean, yeah, it's good to know that, especially if you're going to be in the Army Medical Corps. But unfortunately, I feel like accidents are almost necessary to gain more training. That sounds really horrible, but I feel like that's the only way they're going to add new training. You know, because you never know what you're going to need. So if you just throw a bunch of knowledge at everybody, they're not going to remember all of it. Therefore, they're not going to be able to apply all of it.
And how do you believe that we could better prepare, like, just our generation in general from coming up before something as traumatic as that could happen to them, just so they can have a generalized idea?
We know that when you join the military, or just in general, like for paramedics, even like as EMT, is that the kind of question you're asking for EMT, or is it for military?
Generalized
Okay,
in this aspect now.
So generalized, I think it would be wise, maybe in science classes, to incorporate some kind of first aid, like in biology. You could easily incorporate some kind of first aid, like how this affects your body and how you can treat the body to prevent it getting worse. So some kind of application, medical wise, should be, I think, implemented in high schools at least.
Okay. Okay. And could you please state your name and the date and your title?
Sure. So this is October 10th. I'm Sarah Mullins. I'm Stetson's ROTC battalion medic. And what else did you ask for? Or is that it?
Did you say the date?
Yeah, October 10th.
Okay.
Then
Yeah,
we're good? Okay.
Yeah, we're good.
Yay! Sorry. You can